Hello everyone, Dr.Auro here. The day which you have been waiting for the past 6 months is right in the corner. That is going to be the day where you're going to perform very well. You are going to really focus on the revisions in the coming few days. You will be staying motivated. You will never get distracted. You will put each and every hour's efforts to make sure that you're going to revise the contents well, and all the MCQ solvings, PYQs, PYTs, YouTube videos, lectures, all going to help you and being there in your subconscious mind. Therefore, believe me, you're all going to rock this time. Wish you guys all the best. Let's study forensic medicine. Let's go. Starting with thanatology, it is the study of death. Yes, the skin becomes pale after death. It is called as pallor mortis. You are going to remember algor mortis, which is going to be what? Cooling of the body, and stiffening of the body is called as what? Rigor mortis, and the discoloration of the skin is called as what? Livor mortis. Yes, what is happening after death is going to be algor mortis. The body temperature reduces after death. Yes, livor mortis, discoloration after death, and then the rigor mortis is going to be what? Stiffness after death. Followingly, what will happen? Decomposition, which will lead to putrefaction and also autolysis. Postmortem, immediate changes. This occurs within few minutes to hours. Yes, what is going to be number one? Loss of voluntary movements, cessation of circulation, and also cessation of respiration. Very important. Let's go. Loss of voluntary movement, cessation of circulation, cessation of respiration. Now, what are the early changes, sir? That is going to be with eye changes and mortis. We just revise the mortis. What are the mortis? We have rigor mortis, algor mortis, and also what? Livor mortis. Yes, please remember this. Late changes will be occurring days to month. It will lead to what? Autolysis and putrefactions. Eye changes. Eye changes are going to be early changes. What happens is, in the retina, we will see Kevorkian sign or railway track sign. Yes, this is called as what? Kevorkian or the railway track sign. This occurs 10 minutes after death. Please remember. Cornea. The transparent cornea becomes hazy in 1 hour after death. Question to remember, 1 hour after death, and it becomes opaque 6 hours after death. Yes, the cornea has become what? Hazy, and will become opaque in 6 hours after death. Good. Now, sclera, what happens is dust depositions start to take place. It occurs 3 to 6 hours after death. Question, and this condition is called as what? Tache noir sclerotica. In French, noir means black color. Remember this. This is going to be what? Tache noir sclerotica. If the examiner asks this, you are going to mark it as tache noir sclerotica. The best medium to detect time since death is going to be what? Vitreous humor. Yes, it is the best medium to detect time since death. Vitreous potassium. Remember, vitreous potassium is the best to detect time since death also. Yes. Now, what is this image here, sir? This is going to be what? Raccoon's eye, also called as what? Panda's eye. The image right here is going to be what? Incised wound. Yes, you can also see what? Tailing of the wound. Good. This is going to be what? Graze abrasion, or also called as gravel abrasion. Now, this is going to be contusion. This image is going to be what? Lacerated wound. We can see heavy bleeding and also irregular margins here. This is going to be what? Stab wound. Whiplash injury is due to what? Hyperextension and hyperflexion of the cervical spine. Let's revise. Whiplash injury caused by hyperextension and hyperflexion of the cervical spine. Basically due to what? Accidents and also rear end collisions. This is hyperextension and this is going to be hyperflexion. Head size, you're going to remember 3. One is going to be what? Dolichocephalic, mesocephalic, and brachycephalic. Now remember, dolichocephalics are seen what? Negroids, mesocephalics in causacoids, brachycephalics in mongoloids. Remember, brachycephalic, mongoloids. At least remember mesocephalic, where the Indian skull belongs to. It is going to be at the range of what? 75 to 79. Yes. Neurotoxic snakes. We have all heard about king cobra during our childhood. Yes, it is maximum number of king cobras are seen where? In India, but not commonly everywhere. It's specifically seen in the Ghats. Now, third supralabial is going to be large. Yes, treatment is going to be what? Neostigmine along with atropine. This image here, what is this called as? This is going to be king cobra. Very good. And this one here, this is called as what? Common cobra. It has something special. called as what? The spectacles. This is called as what? Spectacle marks. Good. Now this image, this is called as what? The crate, and this one is going to be called as what? Banded crate. Yes, these are going to be nocturnal. Please remember, crates are going to be nocturnal. Look at the image here. This is going to be what? Russell viper. Yes, please look at the snake's image carefully. And this is going to be saw-scaled viper. Remember, the viper's bite can lead to hemorrhagic shock. Question to remember. And it can lead to what? Affects the coagulation. Yes, the fibrin and the fibrin clotting factors are going to be what? Decreased after the bite in the body. Yes, and this is going to be what? Sea snake. It is going to lead to musculotoxic, and especially what happens? Myoglobinuria is going to be seen after sea snake bite. Yes. Superfetation is going to be four important terms you're going to remember. First is going to be what? Superfetation. It has double T. It means what? Fertilizations of two ova in different ovulating cycles. Now what happens is, one fetus may develop at the week of 34 and one more fetus also could develop at the week of 38. This happens where? In different cycle. This is called as what? Superfetation. Remember, 2T, it has for two ova. Next, and two different cycle. Next we have superfecundation. Fertilizations of two ova in the same cycle. Is called as what? Superfecundation. Next, posthumous child is going to be child born after the death of father. Superstitious child is going to be fake pregnancy or bringing a fake child. Yes. Look at the plant here. This is called as what? Cannabis sativa. Very good. Yes, the various forms of its drugs is going to be called as what? Charas, which is also called as hashish or marijuana. Ganja is going to be dried, unfertilized inflorescence. Inflorescence are going to be flowers. Yes. Good. Now, cocaine. Remember, it is from Erythroxylum coca. This is going to be what? Please remember, cocaine is produced from here. Now, black discoloration of teeth and tongue happens, and tactile hallucination. What is tactile hallucination? Patient may feel like ant moving in the hand. This is going to be called as what? Tactile hallucination. LSD. LSD is going to be lysergic acid diethylamide. When the patient takes it, is going to have increase in the heart rate, respiratory rate, and also mild increase in the BP. The patient may have what? Dilated pupils, and very importantly, is going to have what? Flashback phenomena. Is going to have what? Flashback phenomena. It is seen in LSD. Yes, you will have elevated HR, RR, BP, dilated pupil, and also flashback phenomena. Look at the image here. This is going to be the image of what? Body packer syndrome. Yes, this is a form of transportation of the drugs. Good. Datura poisoning. Good. Most of the complications of Datura also likely starts with D, but before that you are going to look the plants carefully. This is the flower, and this fruit is going to have what? Apple thorns in it. Yes. Good. What are the complications, sir? The patient may have what? Dilated pupil, delirium. He may have what? Dryness of the mouth, and also diplopia. Yes. Now, this is commonly seen in the railway tracks. So this is called as what? Railway track poisoning. And treatment is going to be what? IV physostigmine. IV physostigmine for Datura poisoning. Good. This image here depicts what? Organophosphate poisoning. We are going to give what? Atropine along with oxims. Yes. Dr. Bhatia is starting our offline batches on July 15th in Hyderabad for the upcoming December 2024 session. Yes, we will try to finish the portions 1 month ahead of the exam, and we do have computer lab where our Fmge exam going students give their tests and practice their GTs. So you'll be also having the access to go to the computer lab, practice your subject-wise tests, mock tests, and also GTs. We will try to help you with the maximum efforts to clear the exams with our national faculties, and they will be all looking forward to see you there on July. Thank you. Phobias. Fear of heights is called as what? Acrophobia. Yes. Fear of closed space is called as claustrophobia. Fear of crowd is called as what? Agoraphobia. Remember, agoraphobia and acro, they are completely different. Next, we have mysophobia, which is going to be fear of what? Germs. And then fear of spiders is called as what? Arachnophobia. Fear of cat is called as what? Allurophobia. Fear of dogs is called as what? Cynophobia. Good. Sexual perversions. Now remember, sadism. It is going to be sexual gratifications by inflicting pain to the partner. By inflicting pain to the partner is called as what? Sadism. Masochism is going to be what? Achieves sexual gratification by suffering the pain. When one suffers the pain and enjoying it is called as what? Masochism. Frosterism is going to be sexual gratification by touching the private parts, namely in the crowds. Fetishism is going to be with inanimate objects, and transvestism is going to be when the other person enjoys wearing the opposite sex clothes or dress. Good. Kleptomania is going to be irresistible desire to steal things of low value. Good. Pyromania is going to be the impulse to set fires, and oniomania is going to be impulse to buy things online. Good. Alcohol withdrawal syndrome. We have quite a lot of chronic patients in the country. There was a time when I was sitting in the OPD and the patient comes to the wife and says like, sir, I stopped drinking. I was like, wow, it's good for you. He said like, sir, I stopped drinking since a long time. I was super impressed. And then I asked him, when did you stop drinking? He said, last night. We have lots of crazy patients in the country. So therefore, probably when you start your practice, it is very important to know what happens to a chronic alcoholic patient when you stop drinking. Now, it is called as what? Withdrawal symptoms. Yes. Now, tremors are going to be seen 6 to 8 hours. Hallucinations seen after 12 hours. And delirium tremens, which is very important for the exam, is seen after 72 hours. Delirium tremens after 72 hours. Next, Capgras syndrome is false belief where the familiar person is replaced with duplicate. Yes, replace, the word C with replace. Now, Frigoli syndrome, it is a false belief again where the different people are in fact the same single person whom is under disguise. Yes, if you see disguise, please mark it as what? Frigoli syndrome. Good. Now, this image is called as what? Smothering. And this is going to be what? Burking. Traumatic asphyxia plus smothering is called as what? Burking. And this is called as what? Garroting. And look at this image. This is going to be what? Mugging. Good. Cadaveric spasm is going to be cadaveric spasm. It is going to be having what? Antemortem sign. Yes, person probably was struggling just before the death to survive. Probably he was trying to hold on to something when he is drowned. And what happens? The muscle becomes rigid even after death. Where in cadaveric spasm. Yes, this is going to be the image of what? Cadaveric spasm. Please remember. Blood stain test. You're going to remember with 2 T's. First is going to be Takayama. Second is going to be Takemans. Let's revise Takayama and Takeman test. This is going to be for what? Blood stains test. Good. Now, seminal stains. Remember with the mnemonic BF. B for boyfriend. No. It is for Barbarios and fluorescent test. Barbario test is due to the presence of what? Spermine in the semen. This has been asked in the exam. Please remember. Let's study the PY keys in the form of case study. Now let's go. Mentally ill pregnant female. Remember, a mentally ill pregnant female. Who can give the consent, sir? It is going to be by her legal guardian. Yes. Now, as per MTP Act, consent should be given by female only. That's also a question. Case number 2. Next step of management for snake bite patient. What you're going to do? You're going to check the vitals. Yes. If it is a non-poisonous snake, then you're going to reassure the patient and also observe what? 20 minutes of his clotting time and also the BT. Now, immobilization should be done very carefully while shifting the patient to the hospital. Yes, you should be what? Immobilized. Now, also you're going to give anti-snake venom. Good. Case 3, bomb blast, which is going to be the most common organ affected. It is going to be lungs. Question. If the bomb blast occurs under the water, it is going to be what? The first organ damage is going to be GIT. Very good. Case number 4, a person died in the lockup during police interrogation. The inquiry is done by executive magistrate. Yes, please remember. Next, superimposition is going to be skull identification of a dead person using their photo. This is called as what? Superimposition. You're going to align the skull of the victim with his photo. Yes. Dr. Bhatia is starting the batch on July 15th in a couple of weeks. We have all the national faculties as part of the team who are going to give you a very wonderful lectures. Students will be giving their GTs, mock tests and also subject matter tests in the computer lab where they can have a real-time simulation. And also we will try to finish the syllabus a month ahead of the exam. So for all those your juniors and newcomers, welcome you guys on the board. For those students who are giving the exam on July 6th, you guys have done a wonderful job. A big applause for you guys. All these late night studies, all the tiresome works, writing down notes and sitting down preparing for multiple hours is something which you have dedicatedly done. All the art efforts is going to be paid off very soon. Stay focused, stay towards your revision. Right now is the time where you're going to sprint slightly to do multiple revisions as possible and make your scores better. Wish you guys all the best and looking forward to see you guys all shining. Thank you.